Thank you very much. Appreciate y'all being here today, and obviously this is a very complicated subject, and I do appreciate it. I wish there was some way people could go in and say, I've got to have this procedure, and like a car, you could say if you're getting this, the fancy wheels, then you pay more, et cetera. But it seems that that's outside of our realm right now, although one would hope that with all these young computer whizzes coming on, that somebody might be able to figure out how to plug all that in. And I do agree that there are some things. I mean, I'm going to pay more for the doctor that I know. Happy to do that and able to do that, fortunately. Some people aren't. And so we have to try to look at some of the things that you all already talked about in relationship to insurance and getting, the ability to say, how much is this going to cost me out of pocket before you go forward, I think is important, and you all touched on that as well. So you all are dealing with this huge, complicated matter, and my questions are much simpler. I've just been really concerned. We had a hearing in the health subcommittee where we had all the providers lined up, and it was shocking. I'd heard rumors, but they actually confirmed that because of the way the system currently works, there are cases where you could go to your pharmacist with your insurance company and your PBM and say, I want to get this drug. How much will it cost me? If I don't use my insurance, and sometimes it's less if you don't use your insurance than it is if you do use your insurance because of the complicated formulas and so forth. And Todd Pillion, Delegate Todd Pillion in my district out of Abingdon, Virginia, got a bill through the Virginia legislature, and I heard there were 22 others this morning, that said you can't have those gag orders anymore. Dr. King, do the states eliminating those gag orders, do we find that makes a whole lot of difference when folks go to the pharmacy? Do they sometimes figure out that they're better off not using their insurance because of the PBMs, et cetera?
Thank you. It's a great question. So I think a lot of these laws are new, and so we haven't been able to really do the studies on them. But I think in terms of allowing pharmacists to actually say to the client at the desk, by the way, if you go outside your insurance or you get this generic, you can save a lot of money. Because pharmaceutical drugs in a large respect are those kinds of interchangeable interchangeable products. And so I think that will have, should have some substantial effect. I mean, the idea that they were prevented from doing so by contract before is unconscionable to me. So yeah. I think it's great.
Mr. Carter has a bill, I'm glad to be a co-sponsor of it, to make that a federal policy. And it's really interesting. I was discussing it back home, and a lady said, yeah, that happened to my sister by accident. Her insurance company initially stated that they wouldn't pay, and so she paid for the prescription herself. Then when it came time to renew, they said, oh, we changed our minds. We will pay for that particular prescription. And she found out it was more. She called her pharmacist. She said, what is this? It costs me more when I'm using my insurance. He says, yeah, I can't tell you about that, but if you'll ask me to do it outside of your insurance, you'll only have to pay $17 instead of paying $50. And so I think it's something we need to pass, and there are a fair number of patrons on that. But it was clear to me that we need to look at the PBMs along with all the other things that you all are mentioning as part of the transparency. I know they serve good purpose, but again, Virginia on this, and that's my home state, that's why I keep referencing, but we had Delegate Keith Hodges out of Gloucester directed the State Bureau of Insurance to report to the General Assembly about how PBMs charge for their services and whether they save money or make health care costlier. Among the findings of the first PBM transparency report as a result of his work, mandated by that language, last year there were 152,250 payments with total PBM markups of $3.5 million between July 1st and September 21st. The differential or spread on each claim ranged from 1 penny to $4,932. Do you think that having more transparency and more oversight over PBMs and what they're doing, I know they work hard in some cases and save money, but in other cases they're actually costing the consumer. Do you think that would help?
Yes, I do.
Dr. King, you do. Dr. Chernew, do you have an opinion?
You can call me Michael, please.
Michael.
Yeah.
I think as a matter of principle, people should be able to get the information that they need. So just on the pure principle of it. In terms of the market dynamic, it's much more complicated. didn't talk about prescription drugs because a lot of the situation that you're discussing arises because of the complicated rebate rules that are going on in the prescription drug market, and those rebates they both in some ways they help markets work, but in other ways, and I think more dominantly, they make it much more complicated and much more difficult to have markets work well in healthcare. And so I think that while we could debate conceptually what you should have the ability to negotiate. I think de facto, if we live in an environment where it's just so complex for people to get the price and get simple information, they're told, but by contract you're not allowed to tell them. I think it's just a matter of principle. That's a situation that shouldn't arise, even though it may well result in some people paying more because the discounts that currently the PBMs can get might be less because they don't want everybody to know when they give a discount. That's basically what the problem is.
All right, I appreciate it, and I think that for a lot of our folks back home, they don't understand all the big stuff, but they understand when they go to their pharmacist and they feel like they're being overcharged. I appreciate you. Yield back.
Gentleman yields back. The chair will now recognize